I just want to also say thank you to everyone that tune in every time I organize this event. Thank you for those who are constantly on the webinar, constantly on the call. Honestly, without you guys, it would be practically impossible to be consistent and keep going for the. I've done this now every month since January, and I took a break in June, and took a break in July, and this is the um episode. This is the webinar after. This is the seventh webinar because I took a break in July. So just a big shout out to everybody, Samson, Faridat, Ahmed, and everyone that keeps joining in on each webinar. Thank you so much. So I'm not going to bore you guys too much. So um, to today is a very I've got a very fantastic guest on the call today. But before I carry on, just a quick tip. This is recorded, so if you for any reason need to step out or you want to share this with your colleagues, I'm going to upload it on a YouTube channel afterwards. You can put your camera on if you want. It makes it more interactive. Your camera is on, but just make sure you're muted and only put your or mute yourself only when you're talking to us. Um, right. So I've got three main points on why this is my three whys of doing this webinar every month. And my three whys is the fact that digital is the new it's the new way of how we have to carry on with our work. It's not something that should catch us unawares anymore. It's the how, but it's definitely not the why. The why is our patience, but it's going to be the how going forward. And that's why we have to jump on the train and we don't want to be left behind. And we're more than our titles. You don't have to have digital in your titles to be a digital nurse. We're all digital nurses. Yeah, so long you work in healthcare in a country like the UK, you are a digital nurse. And the last one is another big point why I'm doing it is that collaboration is a new leverage. You can't work in silos. You need to know what's going around outside your trust. You need don't just sit in, oh, this is how we do this in my trust. You need to be asking questions with your colleague outside your trust to know what's going on. And yeah, and that's my three mantra really for doing this. And yeah, I've got this lovely chats from Professor ChatGPT talking us through what the digital competency will look like going forward. For those who have been on this call before, this might sound like a repetition, but I thought it's just important for us to remind ourselves of the why of what we're doing. Another why is it's part of our NMC code of conduct and also NMT future nurse proficiencies. We have to know how to use this digital product or digital technology to look after our patients, and it's part of the code as well, NMC code. Now, I'm going to stop rambling and then focus on the reason why we're here. I've got lovely Monica Menniti on the call today. I stalked her on LinkedIn, bless her heart, and she obliged to be on the call today. I'm just going to read very quickly Monica's bio, and I'm just going to hand over to her. So, at 18, Monica left the US for Finland, where she mastered the language and built a nursing career from scratch. That determination carried her into hospital leadership, a master's of public health, and eventually into health technology. Over the past 12 years, she's gone from bedside care to boardroom strategy, scaling digital health solutions across multiple countries, and now completing her executive MBA in Paris, focused on healthcare innovation and technology. Most recently, she founded Jigi Health, an AI health platform designed to bring safe, affordable care medical to medical practitioners in West Africa. Having worked across startup and health systems, Monica knows what it takes to turn clinical experts into impact. And today, she's going to share how nurses can do the same in the world of health tech. Ladies and gentlemen, I've got gentlemen on the call. Please welcome Monica. Monica, it's good to have you here today.
Hi, thank you so much for having me. I'm really, really happy to be here.
Fantastic. So we had a wonderful conversation when we're chatting, and I would just wanted to just go through your journey again for those who obviously they were not on the call when we're having a chat. Just talk us through where you started from and how you got to where you are now.
Yeah, sure, absolutely. Yeah, as I mentioned in our last chat, I grew up in the US, as you can hear from my accent. I always knew that I wanted to um, see other things and live other places. And so when I was graduating high school, all of my friends were going off to university, and I decided that I wanted to move abroad. So I moved to Finland, and the only way that I could stay is if I got into university there. And so I decided to do that. But in order to do that, I had to learn the language in order to work in the hospital. So I really committed myself to doing that and to staying there. Finland is very cold and very dark. The language is really hard, and obviously being a baby nurse is very hard. So um, all my friends were off at university having fun, and I was toughing it out. But I'm really glad I did because I started my nursing career there, and Finland was an amazing place to be a nurse in a lot of ways because they use technology really, really well. And yeah, it was really set the bar very high. So after that, I was in Finland for about 6 years. And I then did a year in Australia. And during that year, I was recruited as an overseas nurse to work in the NHS. I didn't really know what I was doing with my life in my mid-20s. And I was getting all these emails to come and work in the NHS. So I said, okay, why not? They advertised it as being in London. In reality, it was Watford General, which is very different. But I had already moved there by the time I realized that. But anyway, I got on with it. But I just remember the first day that I walked into an NHS ward, and having worked in Finland, I was really surprised that everything was still on paper, and there was these like stacks of paperwork up and down the corridors, and it was just a lot different to what I was expecting. So I worked on the wards for a while, medical surgical, just in Watford General, and I got really frustrated. And I realized that I wanted to be part of the solution, in making things safer for patients, and nicer for nurses and doctors. So I applied to a job on the corporate team in my trust, and I became a quality improvement nurse. So a lot of that was auditing, and working on digital initiatives of how to streamline things, make things easier. But as you know, if you all work in the NHS, it's always well intentioned, but very different in execution. So I did that for a while, and then after that, I went to work in the private industry, like still in directly as a nurse, in leadership in a leadership role. Actually went to work in a care home as a manager, and was really frustrated there. So I said, look, the only people that are really moving things along in the world of healthcare are people that are working in technology, and trying to fix the problems kind of from the ground up. So I decided that's what I wanted to do. I did my master's in public health, and then I was actually living in London properly at the time, and I forced my way into a job at a tech company. I convinced them to hire me. And I worked as kind of the bridge between the clinical team and the clinical teams that were our customers, and the engineers that were building the products, and selling them into the NHS. So yeah, so that's how my career started. And so I've worked in the tech industry for quite a while now, almost I think 7 years. I decided I wanted more business experience, so I went to do my MBA, which is why I then moved to Paris. And now my partner and I started our own tech company, and that's the project that I'm working on now.
Fantastic. And I find it very, very, very interesting because your journey from the US to Finland, then to Australia, is that correct?
Yes.
Then from Australia to the beautiful Wanford in London.
Yes. That's right.
And then from London, where you had your work experience and all of that, now you are in Paris now. You're doing your, did you say you're doing your MBA or you've completed your MBA?
I've actually just completed my MBA in May.
In May. Congratulations. Well done. And
Thanks.
now you're facing your startup squarely, right?
Yes.
You're that's and what I can hear from what the story you've shared is about taking risk. I can hear that very clearly. Taking risk. And you said something about forcing your way into the tech. You said you convinced them to hire you. That sounds like we can't wait for things to be handed over to us. We literally have to knock on those doors. I had an idea recently about looking for tech companies to give nurses opportunity to do like a 1 week or 2 weeks
Yep.
shadow,
Mhm.
especially AI and healthcare companies. And I couldn't find anything. But from what you said now, I think you're right. I think sometimes you just have to go and knock on people and convince them. So you've talked about your journey. Talk us through the challenges you've faced so far and how you've been able to overcome that,
Mhm.
moving from somebody from a nursing background into a tech startup. What are the
Mhm.
challenges and how have you managed it?
I think probably the biggest original hurdle was when I decided to leave nursing, to begin with. I know a lot of my colleagues, in the NHS particularly were really confused, about why I would want to do that. Um, you know, things like you're going to lose your clinical skills and kind of like, who do you think you are? This is our world here, and you know what? It was kind of like judgmental would probably be the word. And it was different. And I mean, I understand where they were coming from. I had a good job. I had a, if I would have stayed on that career trajectory, I would have been, done well in the NHS, but just wasn't what I wanted. So I think having the ability to like listen to my internal voice of what I wanted to do um, was really important. I'm glad that I listened to myself when I look back on it and not to those people that were not in my shoes. And then going into the tech industry, yeah, you really have to prove your value. I think in my experience, it was probably difficult for people to place you like really like, okay, you're a nurse, you have a very specific set of skills, like what can you really offer here? But in fact, like nurses have so many skills in business, and in customer relationship management, in handling complaints, handling critically stressful situations, so many skills that apply, but you really have to spell it out for people. It's not something that people can really make that the translation of how those skills apply in the business world, for example, unless you really show them. Um, so I'd say I had to prove myself a lot more, than, some guy that graduated with, a business degree and, just kind of walked into that industry right out of school. I'd say it was more of it was more of a battle, trying to convince them. But I have to say that once I did, um, I was really able to show what I could bring in terms of understanding customers, understanding how clinicians make decisions, understanding how patients make decisions, understanding how real workflows work in the NHS. That it really opened a lot of people's eyes, and it really helped the business move forward. And so once you start to get some wins like that, it becomes a lot easier then to translate those into other areas. So it's definitely it's definitely something you have to want to do it at the start. You have to be really committed. But then once you start to get in there and you start to establish yourself and understand the playing field, you can really build a space where you provide a lot of value.
so much. Thank you. I like what you said about you have to want it because
Yes,
that because it's not rosy. Like it doesn't sound as if it's not a walk in the park, to be honest. Yeah,
absolutely.
I like the point that you have to want it,
Yeah,
and I also like what you said about the fact that nurses are we've got skills, but it's just how
absolutely.
to translate that into something people with the business mind can relate
Absolutely.
with. I was chatting to someone, and this conversation about how nurses tend to hold their pee, and because you have so much to do, you just have to hold your pee for a very long time,
Mm-hmm.
and then when we say that, uh, that is the reality of what working 12-hour shift looks like. However, when we say that to people, what we get is sympathy and like, oh, you really work, you are very hardworking. What a
Mm-hmm.
lovely nurse you are. However, when you're talking to a business person, that doesn't mean anything. And like, oh, okay, right.
They're
For a
like,
business person, it's either they
whoa.
look at you that you're not self-caring enough for yourself, you're not looking after
Absolutely.
yourself. But we tend to use this word to which sometimes can be a little bit emotive, but for
Mhm.
people who are working in business, they might not be able to relate with that. So,
Absolutely.
yeah, I'll leave you to explain more on that because I can see you're
Yeah.
nodding. Yeah, yeah,
No, absolutely. And yeah, nurses, that's something that, we're used to. And if you're talking to another nurse, they will automatically know what you're talking about in that situation, or even patients' families or, other people that work in the hospital. They know how tough it is. But yeah, if you say that to somebody in the business world, they're like, oh my God, that sounds horrible. I'm so sorry. And like they can't like really relate to that at all. But if you translate that into like, I am extremely mission focused. When I am focused on a task and I have responsibilities, I will not stop until they get done. That's actually what it means that, you're literally putting self-care way at the bottom of the pile. And don't get me wrong, that's not how it should be, but you're demonstrating that you have the skills to finish a task that needs done. And when you kind of learn how to shift the language and translate that into a language that people in the business world can relate to, you realize that these are really valuable skills, because not everybody has that kind of commitment, and that's something that makes nurses really special.
absolutely. I agree with that. And there's also a conversation about numbers. Like I've heard people say, what do you do? I know the reception. I think nurses are very much respected, and we saw that during COVID. And I
Hmm.
think for most of it, we're just waiting for that to translate into something tangible. But it's a very respected
Hmm.
um, job. When I introduce myself as a nurse, and that's one of the reasons why, honestly, I don't want to leave nursing completely because
Hmm.
I know there's a lot of respect and prestige that comes to when you introduce yourself as a nurse.
Absolutely.
But sometimes we just stop there. But when we want to look into translating into business or into technology, we need to be talking about numbers because the
Hmm.
bosses at the top is the data and numbers they kind of we relate with. Yeah.
Hmm.
When you say you don't just stop by saying I'm a nurse. Start by add to that to say I look after a 25, 20, 45 bedded ward. I'm the
Absolutely.
yeah, and all of that. Yeah. Put the numbers in, and I think
Absolutely.
with that people can relate more to just say, oh, I'm a nurse. I will just talk about the motive part. Yeah.
Great. That's an extremely good point. Yeah, you do so many things that are quantifiable, first of all, and that are really impactful. Like project management, for example. If you're managing a shift of, a staff of 15 people, you have 25 patients under your care, you have X, Y, and Z things to get done during the day. That's a huge project to manage, and quite a sophisticated one at that. And so yeah, it's just a matter of being able to sell your skills. Like you said, like I'm responsible for the care of 25 patients, all of their of 15 patients or what however many are on your ward, all of their medication, corresponding with their families, updating their care plans. That's documentation. Everyone in the business world needs to do that. And so yeah, learning how to talk about being a nurse in a way that you can be really proud of, without just stopping at being a nurse. It takes some practice, because we're not used to, we're not used to doing that. As a nurse, I'm a nurse. I work in dermatology, or I work in gastro, and that's it.
Yeah, yeah, totally. I agree. And I think one thing I would take away from this is to learn a new language about how I introduce myself. So I should not just stop at, oh, I'm a nurse in an orthopedic ward. I need
Right.
to change my language. I think that's what I'm going to take from
Right.
that. And I hope other people, other nurses on this call take that away. That don't just stop at saying, I'm a nurse. When you're introducing yourself, change the language to something that somebody who is not medical, who is
Yes.
technical in the technical world, can relate with, and not just the emotive part. We don't want to
Absolutely.
sit with the emotive part. Yeah, there's a lot of emotion about, oh, how lovely you are as a wonderful nurse, but
Yes.
that alone is not enough. We need to put
Absolutely.
numbers in. Yeah, yeah,
Absolutely. And once you become like more comfortable with speaking about and using that kind of language, it does become easier. But I'll just put it out there. If anybody ever wants to, reach out and have a discussion about how they can kind of elevate their profile or translate their profile, I'm more than happy to do that, or use AI tools, ChatGPT, Claude, talk through these things with them. And just don't be afraid. That was like especially when I was transitioning out of nursing, I had so much kind of shame associated with being ambitious and wanting to do other things. It was kind of like, well, I can't talk about myself in that way. That sounds like I'm trying to be so and so, or I'm trying to do this, or I'm trying to, be somebody I'm not. And everybody else outside of nursing in the business world does that. And so we definitely have to get rid of the shame surrounding that, and that culture of kind of just keeping your head down. Um, I think it's really a shame that is still so prevalent in nursing. We should not be afraid to put ourselves out there and really be proud of our accomplishments.
yeah, absolutely. Yeah, I think it's a shame, and I think sometimes you made reference earlier on about the judgmental part of it, that colleagues just feel, oh, who are you again? Why are
Absolutely.
you're leaving us? You think you're better than us on the
Yeah.
bedside. Yeah, bedside is better than, and there's a somebody has addressed me as, you're not a real nurse. I've had that conversation with someone like, oh, I know you're not that, you're not a real nurse per se. And I laugh because it just, it's quite interesting to see their, to think that when you it's only when you are by the bedside that you're doing 12 hours shift running around. That's a real nurse.
Hmm.
And it's just quite interesting. So yeah, it's about getting rid of the shame.
Hmm.
People will be judgmental. It's absolutely fine, but like you said, you
Yeah.
must really, really want it to go for it, and then
Yeah.
change your language. Yeah, thank you so much for um explaining that. I think that's a key point I need to take away, and I need to reflect on that, how I describe myself. And Samson, I've put something in the comment section about our own elevator pitch.
Yes.
That elevator pitch is it's critical. Yeah, and it
Ab-
determines what you get from your audience most times. Yeah, I totally agree with you, Samson. I think we should do something about that. Maybe
yeah.
Monica, we can do something outside this about how nurses can improve their
Absolutely.
elevation pitch when you're
Yeah.
introducing yourself. So that can be another TED talk on its own,
Absolutely, no problem.
another webinar on its own.
I'd be more than happy to. That's something that I really, really feel strongly about, because I struggled with it myself. So yeah, I'm more than happy. If anyone needs support at any time, feel free to reach out.
Yeah, cool, cool. Thank you, Monica. And that brings me to the next question about, right, so I'm a nurse. If I want to get into the tech world
Mhm.
and be like you, Monica, you are an inspiration. I want to be a startup founder. What do I need to bear in mind? And what do I need to do to get myself from A to B?
Okay, great question. Um, so, um, before I would recommend to everyone to spend some time either with a startup, in kind of like a shadowing capacity or work for a startup for a while. That's what I did when I left, when I officially left nursing. Um, there is a huge world of companies that are building products to sell to healthcare systems. There are countless numbers of health tech startups, and you've probably come across many, many, many of them trying their products in the NHS. And it's in if you look at the big picture, it's a good thing, because the more products that get out there that try and fail, the more likely we are that we're going to find the good ones. But in all of that, and during this time period where technology is it's expanding, it's growing really, really rapidly, it creates a lot of chaos, both on the provider side, so on the clinician side, on the nurse's side, and on the side of the companies that are building and selling the products. There's two parts of that. The companies want to make products that fundamentally they can sell. Their companies. They need to have a business model. They need to be able to make money in order to grow, in order to build their products, scale their products. So this is fundamentally the goal of every startup. And then you have on the other side the clinical setting that are using the products. They want products that actually work for them, that solve a real problem. And it might seem really obvious, but oftentimes people have great ideas of products that they can build on a technical level, but they really don't have much of an idea of how to implement that in a way that actually works for clinicians and actually works as part of the workflow that people already have, as not just another system that you need to log into, or another product that you need to learn how to use, or another kind of half uh half implemented pilot scheme that nobody is really gonna develop or pay attention to, that just takes up people's time, takes up resources, and goes nowhere. So there's a lot of disconnect in this world. And how I really found my place in the tech industry was helping those two sides talk to each other. And I think as nurses, we're really good at that because we understand the reality on the ground. We understand what the problems are, and we understand how they need to be fixed, in a way that is realistic, not just wave a magic wand and everything gets better, but step by step from the ground up. How can we solve this problem in a way that is going to make patient outcomes better? It's going to save time, it's going to save money, it's going to make nurses happier, it's going to make patients happier, safer. All of the things that we know we want to happen. Nurses are the key to to unlocking that, and doctors to some extent too, but I mean, nurses are the workflows of the hospital. So, anything that makes that could make a doctor's workflow easier is directly impacting nursing, vice versa. So there's very few parts of the hospital that the nurse can't help improve. I say hospital, but I mean any clinic setting. So as a nurse, if you want to get into tech, I think a great way to do that is showing the value that you have as being this point of translation. So you help hospitals be more successful in implementing technology. So hospitals, clinics, they make better investments on technology that really works, and you help companies that are building businesses be more successful in their business goals, because if they are solving real problems, then they can scale their business and everyone's happy. And nurses have a really key role to play here. So what I did was I applied for a job that was managing relationships. It's called customer success. That's what we call it in the tech industry. But customer success basically means managing customers after they have gone through the sales process, signed the deal, and come on board. Your job is to manage the relationships with them. So that was my job. And I really had to prove that I had a lot of value to bring to it. But once I was in the role, I was working on the side of the tech company, but all of my customers, my clients were nurses. And I understood their world inherently because that's the world that I had come from. So I would take away, we would have our engineers on one side. I can remember one instance during COVID where we were installing these devices, these sensors, in patients' homes to help monitor dementia patients, help monitor them deteriorating when nurses couldn't go and visit them. Long story, but um, we had our engineers that they were, building the product. The nurses would go and install them, and then the products would have issues, and the engineer would say, "Well, we'll just go and turn it off and turn it back on." And it'd be like, okay, first of all, this nurse has to drive 30 kilometers to get to the patient's house, has to do 6 risk assessments to even go there, has to put on a full kit of PPE, explain to the patient that has dementia why you're coming into their house, go and root around under the kitchen sink for these devices, find it maybe, and hope to God that the patient doesn't turn it off as soon as you leave the house. So it's just not that simple as turn the device on and off again. And so our engineers, they were brilliant engineers, but they just did not understand this. And so with time and we were working together, I was really able to paint a much clearer picture for them of what the realities were. And in the end, that led them to designing much better technology, and we had much better outcomes because the technology was really built for the environment that it was actually in. So I'm giving you that example to show you like the real value that we can have. And again, it comes back to how do you demonstrate that this is the kind of value you can bring to a company? And how do you translate those skills to the business world? Because in the end, it is about helping companies grow. If you join the tech industry, you have to be willing to show that you're there for business, and there's nothing wrong with that. That's how the world works. And you can still be responsible for driving better outcomes, even if you're working on the business side.
Fantastic, thank you. So, what I can hear from you now, you're suggesting that if you were interested in getting into tech, you want to know what's going on in that world, it might be a good idea to spend time with somebody, with a company who is doing that already. For example, if I'm a cardiothoracic nurse and I'm
Hmm.
interested in technology in that
Hmm.
aspect, I should look for companies who are into remote monitoring of patients with cardiothoracic problems. I should look at companies that help install defibrillators, who
Mm.
produce defibrillators and all of that.
Simple, yeah.
I can look into companies who do wearables, for patients who's got
Hmm.
cardiac issues, specific for cardiac issues. So that helps me to say you're not going out of your field, you're just narrowing
Right.
down to say what is the technology aspect of this,
Absolutely.
what is outside of this that I can just reach out to them, say on LinkedIn, send them a message
Absolutely.
to say, I'm a nurse, I'm a cardiothoracic nurse, this is
Mm.
what I do, how can I help you? I can do this for free so long
Yeah,
I learn from you and I get to understand how you do what you do, and it's a win-win thing. So
absolutely.
that's why I can hear from you, and I think Farida is agreeing with me in the chat
Mhm.
saying that makes sense. So um
Yeah.
so it's not like I want to go into tech and I just pack up my job, hand in my notes for my
Same.
full-time job. I've got bills to pay, so that's not feasible. But but a
Yeah.
good way to start is just looking out for those companies and volunteering for them in your time, and then you can learn both ways. So I think that's a brilliant way, and thank you for mentioning that. Yeah, so
No,
that's a
yeah.
good way to start. Yeah.
No, no problem. Yeah, that I would say, I mean, I would say, in business school we always talk about what's the value? What's the value proposition? And I mean we talk about that so much it becomes annoying after a while to hear the phrase, but you really have to propose what you can bring them. And sometimes it's not immediately obvious what that is, but one like concrete example or concrete way, that I could think of is if there is a digital health pilot or initiative, or there's some new technology being tested in your trust, find out what that technology is, find out the company that's behind that, and find out what the goal is of that pilot. Is it to, I don't know, reduce falls? Is it to improve outcomes for cardiac patients, identify sepsis earlier? Whatever the goal is, figure out what that technology is trying to do. Because I guarantee you, on the other side of that, the company is trying to reach their targets so then they can turn around to the trust and say, look, we reduced falls by 40%. If there's something blocking that technology from being successful, you have the key to unlocking that. And that information is of huge value to the company. And so if you could, if there is a project going on in your trust and you do some research and you kind of dig into it and you realize that, oh, they're putting, these there's these falls uh mats on next to patient's bed, but they're being unplugged. The cleaners are unplugging them, or the patient's family don't like them, or whatever reason. Identifying like a core issue and bringing that to them and saying like, look, I'm a nurse. I've noticed this. I think you could improve your outcomes by doing XYZ. That information will be gold. And so, yeah, you might have to do it for free at the beginning, but once you really prove your value, people will pay you money for that for those insights. And there's nothing wrong with that. I think we talked about this last time we spoke, is it's okay to want to join the business world. It's okay to want to make money, even as a
Absolutely.
nurse. It's a very taboo concept for nurses. But like I said, the rest of the world runs on making money on doing business. And fundamentally, so does healthcare, so does the NHS. And so if nurses become part of that conversation, I only see it being a good thing.
Fantastic. Thank you. I totally agree. And it's quite interesting because when I talk to people about what I do, and the first thing they ask me, oh, how did you get into this job and all of that? The first thing I ask them to say, what is the name of the supplier of your EPMA in your trust? And they
Mm,
go, oh, EPMA. Let me know. No. What's the name of the supplier of your, because
yeah.
electronic prescribing medicine administration systems
Mm,
it's the same. Why? Well, it should. It's the aim of it is to prescribe electronically, record administration electronically, but they are different suppliers. And what that means is that the workflows will be different because the designers are different. So because the designers and the engineers are different, they sometimes they design it in a way that is good, and
mm,
sometimes it's not great.
yeah,
So at the end of the day, it's the same electronic prescribing system, but because the suppliers are different, the engineers are different, it will
absolutely.
work differently. So people come to me to say, "Oh, I work in that particular trust. When I click on this, this is what happens. But for this one, when I click on it, it doesn't do the job." And I'm like, "Yeah, because the
Yeah,
suppliers are different."
absolutely.
So I
Yeah,
think
absolutely.
something basic as what's the name of your EPR supplier in your trust? What's the
Absolutely.
name of your EPMA supplier in your trust? Do you know? Yeah, do you know how many trusts are using that same supplier? I think
Absolutely.
something as basic as that can be a long way around to say, right,
Oh,
maybe
yeah.
I can help. Yeah, so
Absolutely.
be a
And
good
I
start.
mean, these contracts, so like contracts that the trust will sign with the supplier. I mean, these are huge value contracts, and companies compete for those contracts. And if you can provide information to a company that will increase their chance of their contract renewing, expanding their contract, improving feedback that clinicians give about the product, the system, that's huge value to them. And like I said, they are willing to pay for that, and potentially hire you, work with you, um, because that's if their contract is worth 2-3 million upwards pounds, that's nothing for them. And this is the scale that we're talking about. Um, everywhere from, like you said, like electronic patient records to booking systems to, monitoring tools. All of these have a supplier that has made money from getting that product into the hospital, into the clinic. And you can figure out how to make yourself part of that value chain, because there is a lot of money changing hands, whether or not nurses talk about it. But it's what keeps everything running.
Totally. Yeah, totally. I agree. I agree. And I think you mentioned earlier on about being a I think being a digital champion is something that would encourage everybody. If you're on this call, if you're not working in digital space, the best place to start is be a digital champion. So in your trust, one thing I find out in my role that I think it's a big gap is that feedback. All right.
Mhm.
So this is what happens, yeah. A nurse log onto a EPMA system, then the nurse discover that, oh, that's not working okay, right? And the nurse has two options, right?
Mhm.
Either to put what I'm doing, just hold on for what you're doing now, and be on the call to IT for the next 20 minutes, be on the call to IT to solve that issue, or
Right.
carry on looking after a very poorly patient in front of me. As a nurse, I will want to look after that patient in front of me instead of trying to resolve any technical issue and stay for 20
Absolutely.
hours. IT guys, no offense to any IT person on this call, but IT guys they can very you can't see them. You don't know where they are. They're just behind
Yeah. And
somewhere.
they have no idea what's going on in front of you.
So
You're
if
just
you as a nurse, you are feeding back, you're making it, you're intentional doing that, they will know you in your trust to say, oh, that nurse will always report. She knows what's going on. You will be
absolutely.
that point of contact to them. You'll be like, oh, can you reach out to the nurse on that ward? She's really good. She knows what she's talking about. And that can be a starting point. Yeah.
Absolutely, absolutely. You can really build yourself up as a wealth of value, to suppliers and to your trust, by, even if you just put all of the feedback together, if you look for themes, if you document the impact. So, okay, I wasn't able to do this. This was the impact. This then caused me to have to spend an extra hour, doing this by hand, or whatever the impact was on yourself, on the patient. Document that, feed it back to the supplier, feed it back to the trust. It is absolutely crucial, to improving systems, but then it also makes you very valuable. Like you said, you become the go-to person, and that's a great starting point for you to work your way up.
Fantastic. I like what you said about documenting, and
Mhm.
documenting because that's been my biggest stress. Because I walk onto a ward and they tell me, oh, in the last 10, I've not been able to use that button on that, for example, on
Mm.
that APMA system for a while. And I say, how many times did that happen? Oh, so many times. Oh, did you report it? Oh, no,
Yeah.
no, no, not really. And I'm like, I can't help you if I don't have how often it has happened. What
Yeah.
happens when you click on that button and when it doesn't work? It's really difficult. So I like what you said about adequate documentation. Right? You may not have the time to always report it in bit by bit, but you can put all of that together, draft
Mhm.
an email, escalate it, put it in writing.
Yeah.
So thank you very much for that point about
Mhm.
documentation. Yeah.
Yeah, it really helps. And there's so many tools that make documentation, easier nowadays, like dictation and, just even making quick notes, and stuff like that. And they can really, really, you'll be thanking yourself later on when you have it all written down.
Cool. Thank you. I'm going to stop talking now and I'll open the floor for people to ask questions. We've got 15, yeah, or less than that now. We've been talking for, people, it's a saying that you don't know, time flies when you're having a good time. So I'm having a
Absolutely.
fantastic time. I can go on and on and on. So now it's time for for you to put your hands up and ask a question. The first person I've got on here is Farida. Farida, if you can unmute yourself and ask your question, please.
Thank you so much, Monica and Tobilayo. It's been an interesting section. I mean, I've learned new things from niching down to specialty. I mean, that's something I've not thought about. So that's new for me. And even like looking for company piloting new tech in the trust. I could remember a 4 risk tool that was just piloted in my trust. And I was thinking, I could do something with that. So
Yeah.
that's massive. Thank you so much for that. So
Yeah.
I've got a couple of questions,
Sure.
if you don't mind.
No
So
problem.
To start with, my first question is, um, I know you said something related to this, but I still want to pick your brain on this. So, what sort of contributed to you getting your first tech job as a nurse? I mean, how did you prepare yourself for that transition? Did you think your MBA has an impact, or did you even think your MBA play a huge impact in creating your tech startup?
Mhm.
So just to give like a context to this, I'm a nurse who is also studying an MBA. I'm
Oh, cool.
finishing in 2 months' time. I'm currently doing my
Okay.
dissertation on digital health in my trust as well.
Amazing.
So
Congratulations.
I just want to pick your brain on, on similar trend, how I can also leverage that, including with my interest in digital health. Thank you. That's my
Yeah.
first question. I will let you answer that first.
Okay, no problem. And congratulations on your
Thank you.
MBA. I love to hear when nurses are studying business, and yeah, super exciting. So when I to be more specific about the transition, so I was working in the NHS in corporate nursing and quality improvement. From there, I left to go and work for Bupa as a care home manager in London, and well, clinical services manager. So not the full manager, but like second in command and in charge of all the clinical stuff. Um, so I did that for about a year, and I just I just realized it was not for me. It was really, really hard. And I was even more sure at that point that I really wanted to move into tech. I had already decided to do my master's in public health. Um, and I did this because I didn't really know exactly what I wanted to do. I knew that I wanted to kind of have a more bird's eye view of the entire healthcare system, of really looking at like, okay, we have patients up and down the corridors in A&E. Why is that? What is going wrong? What's going wrong in primary care? What's going wrong in prevention? Why are there so many sick people that we can't take care of? And so that I think was really fundamentally what drew me to public health. Public health is very kind of closely linked to nursing, in that it still takes a very like statistical, clinical approach to the healthcare system. And I think for me, what that really showed was that like the solutions aren't coming from within the system, because even when you move into like the proper public health space, it's still a mess. You're still dealing with budgets and government and districts and local and so it was pretty clear pretty quickly that the solutions weren't coming from there. And I just kept coming back to technology. So when I was working at Bupa, I was like, super frustrated. I was just finishing up my master's in public health, and um I was, when you're just like so frustrated, you're just like scrolling through jobs of like, what literally else in the entire world can I do other than this job? Because if I
Yeah.
go back one more day, I'm gonna lose my mind. I started to come across kind of some of these jobs in the tech industry. And I noticed like, oh, this is like kind of related to health. Like okay, this makes sense. Like these companies are making products that are related to healthcare. I didn't know anything about the job descriptions, sales, engineers, customer success. Like I didn't know what any of that meant. Um, but I really just started to research it more. And I started to kind of be curious and think about like, oh yeah, like I have seen these kind of um products before. I've seen these kind of pilots before. I've seen these kind of it just kind of started to like make sense to me that like, oh yeah, there are these initiatives that are happening around technology that have been in all of the clinical environments that I've been in. So I really started to just make a hypothesis that this could be something that I could potentially do. And so I started to like in a very bad way, like I had no idea what I was doing, but I started to just kind of modify my CV, send them out, probably sent 100 and got 0 feedback. And slowly but surely, like over the course of, I would say, maybe like 6 to 9 months, just as I was like coming up to my absolute limit of my current job, I was almost at the point of like, okay, I'm just gonna quit and have no income because I can't do this for one more day. But I did eventually land an interview with a company that was making IoT sensors for patients' home environments, and they were working with the NHS to to install them in patients' homes, monitor patients, and see if they couldn't detect deterioration earlier than without the devices. So yeah, I remember like I went to the interview, I was so nervous. I was like, oh my God, they're gonna think I'm an idiot. Like they're gonna they're just gonna think I'm an idiot. They're just gonna laugh at me. But I did it, and I'm really glad that I did. And I, it just took that one person to listen to me and really give me a chance, and I ended up getting hired. Um and yeah, then I was like, okay, I have this opportunity. I'm gonna make the most of it, and I'm gonna really learn from this. So yeah, it was, I guess I want to like I want to say like, yeah, it was like, super easy determination, but a lot of it just came from like desperation. I was like, I have to do this or I'm gonna go crazy. Like I'm not there's no other option for me. So yeah, that's how I got directly into the tech industry.
Okay, thank you so much for that. So my second question is, just to give you a bit of a context. So about 1 or 2 years ago, I was going to start a startup, a mental health app using AI. I was
Mhm.
going to integrate virtual reality, augmented reality,
Okay.
and I managed to build the project up until MVP stage, but I
Mhm.
couldn't scale beyond due to technical difficulties and funding. I was
Okay.
working with like volunteers, like my technical team were not, I was just paying them stipend. I didn't have the money then. So,
Mhm.
and I had to like close the project. So the project is more of like just like a project in my portfolio now. Like
Yeah.
I just sort of to prove that I built something, I built a project,
Oh,
like solved a problem, sort of. But
absolutely.
since then, I've been more of an intrapreneur. And what I mean by this is I've been working with like other startup or other tech organization.
Yeah.
But deep down, I know someday I still want to build my own product. I still want to, build my own
Yeah.
community, my own organization. And
Absolutely.
I've just been thinking, how do I put myself forward for that? From finding that perfect or the
Yeah.
best idea or the best problem to solve to now building and scaling even amid all the challenges, like I mentioned, my
Yeah.
my my previous challenges of like technical funding and all sorts.
Yeah. Oh, girl, awesome job. Like even just going and trying it and doing it is, even if you fail, like it takes so much courage. It is so difficult. And the experience that you got from doing that will absolutely contribute to your future success, which I am very confident in, by the way. Just from hearing you talk and just from hearing you share. When you have that kind of mindset, where you know it's something that you really want to do, if you have the, hard work and commitment to follow it, you will absolutely get there. So just well done. Um,
Thank you.
I think, I mean, probably as well, it's really hard, and you really have to be willing to kind of go without in the early days, unless you're lucky enough, to come from money or have, huge sponsors or something like that. But I think the most important thing is that you build something that solves a real problem, and that people want to pay for. And in healthcare, this is much easier said than done, because you can have a product that absolutely solves a real problem, but that the business case is not there to fund it, to scale it. So I think your MBA is going to help you massively. And I think your question before was whether my MBA helped me. So you can see it, like I did my MBA like much later on in my tech career. After I'd been in the tech industry, I worked for startups for like 7 years. Then I decided to do my MBA because I really wanted to have a bigger understanding of these business conversations of, what are the drivers, how are financial decisions being made? And that has absolutely helped me, and I think it will absolutely help you as well. But yeah, just, I mean, going back to like having a product that people want to pay for is really the hardest part. And so use those business skills to really understand what drives value, and most importantly, building a product that has the unit economics built into it that makes it scalable, that the value that you get for the price is something that can not just apply in one hospital or in one clinic, but this is something that everybody is going to want and that you can make a really, really solid case for. I think finding this in healthcare is the hardest part. And I could talk all day about this. But yeah, really asking yourself the question from day one, who is going to pay for this, is the most important thing that you can do.
Great. Thank you so much. And by the way, I just sent you a connection request on LinkedIn. So
Yes, absolutely. Feel free to reach out. I'm more than happy to tell you, about my startup, more about I realized I didn't talk very much about my experience specifically with my current startup. But I'd be more than happy to do that. And, I probably have plenty to learn from you as well. So it's great to connect.
thank you so
Yeah,
much.
thank you very much. Yeah, I realized you didn't talk much about your startup. Do you want to talk us briefly about what you do now in your startup? What your startup is all about, very briefly?
Sure. Yeah, I'm more than happy to. And I think this also like goes along with, your last question. Wait, before I do that, did I actually answer your question? Or is
Yes,
that
absolutely. You did.
okay? I just wanted to make
Thanks.
sure I didn't leave anything out. Yeah, so my current startup, to be honest, I don't know that I ever had the same kind of conviction that you had, that you knew you wanted to start a company. I really admire that, because I was always like, I know I like to be a leader, but I didn't know if I was really bold enough to do it myself. But it actually came about when I met my partner, who's also my co-founder. And he is an engineer, and he's wanted to do a healthcare project for a really, really long time. He has other businesses and other startups, but healthcare was always something that he wanted to do. And, we were talking about it, and he had ideas, and I had ideas, and he, for him, it was really important. So he's from Mali in West Africa, and he wanted to build a product that can help people there. And I was like, look, I can help. I can offer my skills in whatever way I can, and we can try and build something together. And he was like, yeah, I'll build it. You tell me what to build. And I was like, are you serious? Like, I didn't realize that, like, he was really ready to go. Like, he really wanted to do this. And so we decided just to kind of go all in. And we started building at the beginning of this year. So what we're building is uh, an AI doctor for medical deserts. So places where people don't have doctors. And we're not trying to replace doctors. We're literally trying to build one that is affordable and accessible, where they would just otherwise not exist. So Mali has, and this was one of the statistics that kind of convinced me that this is a project that really worth working on. Mali has like around 2,500 doctors for around 20 million people. And the gap to close that would take decades and billions of dollars that are just not coming from anywhere. And then on the other hand, you have AI that's surpassing human doctors on medical exams and performance. And yet this amazing technology that the rest of humanity is benefiting from is not translating into that environment. And a lot of that comes down to cost. So what he wanted to build was something that is really smart, really cheap, and really accessible to everyone, like even if you can't read and write. So so that's what we're building. And he luckily has like a lot of connections in Mali and in Ivory Coast. And I do struggle with French, but the clinical side is something that I've been able to help with in terms of safety testing. I'm working with doctors there to test the product in the field. And I'm also working on, growing the company, looking for investors, creating a marketing strategy, understanding how we're going to go to market, who our customers going to be, how are we going to get this to people. So that's what we're building. That's what we're working on. It's early days and we're in the fundraising stage right now. So we're looking to raise money, and this is really hard. And my MBA has absolutely helped me with this, but it could not have prepared me for how tough it is. So
Yeah, thank you for sharing that, because I know the way you said about your using your clinical insight, because I know in the landscape of AI in healthcare now there's a lot of dark boxes and black boxes that we don't understand what's going on. And it's really important to have clinician in the loop, sense checking everything. And I think it is very lucky to have yourself as a clinician looking over that, because there's a lot about the
yeah,
safety part of it, there's a lot about hallucination, and
absolutely,
there's a lot about data, because it's what you build the data on is what you get out. So in
absolutely,
countries like Mali and all of that, that like West African countries, that you don't have homegrown data and all of that. So there's a lot of complexity to it.
oh
So it's brilliant that you have yourself as a clinician looking after that. And I'm absolutely sure that you get the got that covered. Yeah, the
yeah.
clinician aspect, and it's a gap that is really wide at the moment. Yeah.
Oh, absolutely. Absolutely. It is like, I mean, like I said, he is a brilliant engineer and he is really, really good at building products, but he has no idea when it comes to the clinical side. And bless him, he has learned a lot. But yeah, really having like, even before we ship our product to a doctor for them to test in the field, like you have to kind of sense check it like first, like, is this even remotely safe? Is this,
Yeah.
and one of the things that we've built into it is forcing the AI to expose their reasoning chain to show how it makes decisions so that it can be audited at every step. And this is really the only way that you get something that is consistent and reliable
Mm,
and safe. Because AI is capable of a lot, but we also know it's capable of a lot of hallucinations.
mm,
So really building that safety layer in from the beginning is something that, as a nurse, I won't let something leave my
absolutely.
unless I know that it's safe.
Yeah.
And so yeah, that's it. I mean, it's just another example of how important healthcare professionals are when building these products, from day one.
Yeah, fantastic. And the another point is you didn't have to go away to learn how to code, or go away to go and study engineering to get
Right.
into what you're doing, because that's what sometimes the impression that we have, that the AI in healthcare is so there and we are here. But the
Yes.
idea is our clinical experience and knowledge is the most important thing. And it's not about learning how to code, or if you want to learn how to code, it's fine, but it's not a
Yeah.
prerequisite to get into doing what you're doing now. Yeah,
No,
yeah,
absolutely not. No, no, it's complementary. I mean, coding is very hard, but also so is clinical practice and so is medicine. So, they're two really important skills that are complementary, and it's good to know the basics. Like I have learned the basics of some kind of coding stuff, but I don't do any of that in my role, at the startup. So, yeah, it's really you can lend yourself and your skills in a really complementary way to somebody with engineering skills.
fantastic. Thank you so much. I'm very much aware that
Oh, sorry.
um, we've gotten over the time. I'm just going to, right, for anyone on this call, if you want to, that I emphasize the importance of networking and connecting with other people. So if you
Mhm.
want to take a photo of this on your phone, join these networks on there. Some of them are on LinkedIn, some of them are online. I think it's a good way to start.
Mm,
Um,
definitely.
yeah, it's a good way to start. And the last bit for today is about your feedback. I would really appreciate if you can spend two or two 2 minutes. The feedback doesn't take a long time. If you have a phone there, if you want to take a screenshot um of the QR code on your screen, fantastic. I'll keep that on for a while. Oh, hang on a second. I'll just leave that on the screen. If you want to take a screenshot of the QR code and give us your feedback, would it will go a long way. And thank you, Monica, for putting your WhatsApp number on there. Um, that shows how open you are for people to
Yeah,
reach out to you. Thank you so much. But
absolutely.
I'm okay. I'm going to do like a draft of our conversation today. So I'm going to put your link on LinkedIn there as well. And if you're happy for me to add your number as well, that would be brilliant for people
Yeah.
to reach you.
Yeah, feel
Fantastic.
feel free. Yes, I'm more than happy. If you want to talk about any topic discussed here, more in depth, a different topic, please feel free to reach out. And if you're interested in the project that I'm working on now, our company is called Jigi. And if you're interested in getting involved in that, we're really small, and if you want to get some experience, I'd be more than happy, to get you involved in any way that you'd like to be.
Fantastic. I think I've just been asked to go back to the previous slide. So I'm going to leave this again for just a few more seconds. So on this slide, we have a sharing network. We have the Federation of Informatic Professionals. We have AI Nurses Network. We have the Digital Nursing Community. And we have the Arts and Digital um, Nurses Forum and Digital Health Discourse. I think they're a good way to start to network with other people, and that's the QR code. And then what I'm going to do is oh, I'm not sure I can put this in the chart. Right. So I would also put the link to the feedback from in the newsletter I'm going to send out. So that's it, everyone. Thank you for a wonderful time today. I'm really sorry we've got over. We meant to finish about 10 minutes ago, but here
Sorry,
we
no,
are
that's my fault.
chatting
Sorry.
away.
Sorry.